Thank you, Sandra. So this is, well, good morning, everyone. We're thrilled to be able to offer this briefing with the governor's office. And we're grateful to sponsor this opportunity here directly from administrative leaders, including Governor Walz, Lieutenant Governor Flanagan, and Human Services Commissioner Jody Harpstead. We have about 600 participants registered for this first of 4 weekly briefings with the governor's office. When this call was announced, we put out a call for questions to pose to the governor's staff, and MCN's Public Policy Director, Marie Ellis, and Minnesota Budget Project Director, Nan Madden, organized the questions, shared them with the governor's office, and we'll present them in the Q&A section of this agenda. We have about 1 hour for the call, and our agenda is to first hear directly from the governor about the current situation, then share an outline of nonprofit impacts and what we've heard from our members about what is still needed. Note that the governor has limited time and will need to move on to another call partway through this one. Lieutenant Governor Flanagan and Commissioner Harpstead will remain on this call to make further comments and respond to questions. Lieutenant Governor Flanagan will share an update on work done to date to protect vulnerable populations, and DHS Commissioner Harpstead will share info on recent actions DHS has taken, including to support providers. The final section will be Q&A using the questions previously submitted. Each of these weekly calls will be recorded, as Sandra mentioned, and available with a link afterward. And we will also include links to some developing issues, including the DHS COVID-19 waivers, Minnesota housing eviction FAQs, and deed employer resources. MCN has created several resources in response to COVID-19. A COVID-19 page with resources and links. We co-hosted a briefing with the Minnesota Council on Foundations on fundraising resources, including the new $5 million MCF Disaster Recovery Fund, Otto Bremer Trust's $50 million commitment, and the Headwaters Fund for Justice. That hour-long briefing is also available online. MCN has posted a free resource, a special edition of the Minnesota Grants Directory online of resources that have already been devoted both through the Disaster Recovery Fund of MCF, but also by other funders available, and that is available free online. And then finally, on April 2nd, we'll co-sponsor a briefing with Minneapolis Federal Reserve Bank President Neil Kashkari, talk about the effects of the economy and the federal legislation on nonprofits. So I think shortly we'll be joined by Governor Walz.
John, I'm here right now.
Perfect. Over to you. Thank you.
Well, thank you, John. Thank you to everyone for joining, the Lieutenant Governor, Commissioner Harpstead, and myself. A general thank you for the work and for what you do to make Minnesota the unique state that it is because of the work of our nonprofits. Very robust and very active nonprofit community. Thank you for the friendship and partnership, both as a member of my community and then as a member of Congress and now as governor. We're in unprecedented times. I know that goes without saying, and this is going to take a not just whole of government approach, but a whole of society approach to get this right. We're going to need leadership in every corner now more than ever. What we always said was one of the keys of this administration was to bring Minnesota around to a one Minnesota perspective. This proves the need for that, I think, more than anything. We're mounting an attack on this based on the data. We're using the resources that are unique to Minnesota, a robust healthcare system, a private sector that focuses on the healthcare sector heavily, and then, of course, a nonprofit that is probably second to none, providing a safety net and a richness to life. So we've issued numerous executive orders to try and stop the spread. I am pleased. I just got off the phone with my fellow governors with a call with the president, vice president, Dr. Fauci, and his team. The president acknowledged today that when he was presented with the modeling that showed 2.2 million Americans would likely die if we had done nothing, he seemed surprised by that, he said, over the weekend, and it changed his course on opening by Easter, which I think we knew was not realistic and are trying to plan accordingly, but with an understanding all the issues that come with social isolation for people, from mental health issues, and of course the economics of it. So we asked the state legislature to put together a funding package. We obviously don't have the reach of the federal government does, but one of the things is we can be more nimble and move more quickly with our partners, and that created a $200 million healthcare response fund. Went right to our healthcare system, our first move, and then we followed it up with $330 million in response packages, grants to providers, funding to food shelves and homeless shelters, $200 million more in a Minnesota fund that will allow me to move resources as quickly as possible and help us focus on public-private partnerships to manage this thing. So I think we know we've got a lot of work to do. I don't think it does us any good to tell our citizens this is going to be over quickly. It is not. The potential for multiple waves of this is at this point probable. And so we want to make sure that we're communicating as much information as we have. We're hearing the best ideas from every corner of the state. We know the challenges that you have. All of you live on a razor blade of finances. Everything that comes in your door goes out to serve people. Your workforce is on the edge. We want to make sure that the safety net helps provide for them and that you're still able to carry out your mission. And that mission is rich, it's deep, it goes beyond just healthcare, it goes to quality of life for people, and we want to make sure we get that right. So I'm going to turn this back over to John, listen for a little bit, and then Lieutenant Governor Flanagan, Commissioner Harpstead will stay on for the remainder of the call. But again, please accept my deep gratitude. Please know that we've asked Minnesotans to give us some time. That time is paying off in terms of the number of beds we're able to stand up. We're near the top in terms of testing per capita. We're seeing Minnesotans social distance, and then we're creating, I think, a tightness of collaboration in critical lanes of, whether it's hospital surge, alternate care facilities, critical care supply procurement, creative partnerships. All of those things are happening in a concerted effort, and this call is a part of making sure you're looped into that. So, John, I'll turn it back to you.
Great. Thank you, Governor. And certainly we expect Minnesota to rise to a challenge. So our first priority, clearly we as a community agree that the top priority must be addressing the public health emergency. And so we really appreciate the accelerated resources, executive orders, legislative action, and on top of everything, the extraordinary work of Minnesota healthcare workers and public health workers, especially since we know the task for them will only become harder. And we can see an economic crisis following close behind. So if we think about how has the pandemic affected nonprofits, it's in many of the same ways as the rest of the economy, as well as in some ways particular to nonprofits. So we've also seen catastrophic revenue loss, closed facilities, massive staff reductions and unemployment claims, increased demand above and beyond. And just to give an example, I spoke with Bao Vang this morning, president of Hmong American Partnership, which is the state's largest immigrant and refugee serving organization with 25,000 clients. They've fielded over 6,000 calls so far in response to the COVID-19 crisis, 150 alone from small business owners about how to access SBA loans. Support needs to be culturally and linguistically competent, and clearly when they're working one-to-one with clients, that takes a lot of sort of direct communication and can take longer. HAP has a lot of experience in this area of sort of meeting the needs and partnering with government. They helped enroll 10,000 people in Minnesota Care. Other organizations face similar challenges. CAPI, the Karen organization, we know that this is a tough time, and then there are literally thousands of other nonprofits facing their own unique challenges with some of the same sort of needs for support, for flexibility, and for funding. The $2 trillion CARES Act is a huge national investment with a time-limited process. So I think it's in all of our interest to make sure Minnesota employers, including nonprofits, have access to the information and fair access to emergency SBA processes. We also know that the CARES Act was a huge step, but alone will not be enough. And so this is where The nonprofits want to continue working with state government and our congressional delegation to ensure that both struggling Minnesotans and nonprofits have the financial resources to get through these tough times. Nonprofits appreciate the actions your administration and departments like DHS have taken to increase flexibility in service delivery. And we share the goal that Minnesotans be able to access critical services and that service providers can continue to serve their communities in this completely changed environment. We're relieved to see that the Attorney General's office has granted an automatic extension to charities reporting and audit filing by 4 months. This kind of action is useful and unprecedented, and we need more of it. There's also a special situation regarding unemployment insurance for nonprofits. The CARES Act took care of this partially, but we have hundreds of nonprofits with major layoffs, which will be left short when they receive the CARES funding. I think we're so grateful that the Walz administration and the Flanagan administration have stepped forward and encouraged nonprofits to participate in this process. And certainly our message is don't forget nonprofits, and today's call is an example of we have not been forgotten and we appreciate being included.
John, I can't tell you how much I thank you, and we hear you on those things. I think today's call will be helpful for us to start thinking very granular about how we are able to reconstitute as much of your workforce as possible, keep them safe, but keep your capacity up. I do think it's not lost, I'm sure, on all of your membership that that your the two people I surrounded myself with who know this, the nonprofit world as well as anybody, are former nonprofit CEOs, and Lieutenant Governor Flanagan at the Children's Defense Fund, and of course Commissioner Harpstead with Lutheran Social Services. So I hope that everybody on the call knows that the voices at the table are loud in the nonprofit world. They are focused and they are results oriented. So I'm going to drop off the call, but I'm going to leave you in good hands with Lieutenant Governor Flanagan and Commissioner Harpstead.
Thank you so much. Lieutenant Governor Flanagan.
Yes, thanks so much, John, and thanks everybody, and thanks to the governor for kicking things off. I'm really glad to be on the phone with all of you today, and I appreciate you taking the time. I wanted to just acknowledge this up front, that oftentimes when I identify myself, I talk about being, a recovering executive director. And truly, I share that with you because I know that every day you all are focused on making sure that you are meeting the needs of people all across the state of Minnesota and the communities that you serve, and that you're also thinking about how to make sure that your staff has what they need to pay their rents and pay their mortgage and care for their families and have health care, and all of those things certainly weigh on people in executive leadership right now in an even more urgent way. So it's just important for me to acknowledge, and I think that Commissioner Harpstead will as well, that we really see you and we value you, and we care tremendously about each and every one of you and the infrastructure of nonprofits here in Minnesota. As we encourage Minnesotans to stay home to reduce the spread of COVID-19, we know that we're impacting businesses and workers, families, and individuals, and that these Minnesotans will continue to need support from the state and support from your organizations as the situation continues. We know also that when the economy contracts, there's a disproportionate economic impact on communities of color and people who live in generational poverty. I'm glad that we have such a strong nonprofit sector in our state, because I think that you're on the ground and able to continue raising the concerns that you see in communities who are most vulnerable. The governor covered some of the recent funding, which is key, but at each turn we've tried to do what we can from our office to mitigate the impact of closing businesses by providing key benefits and supports to Minnesotans who have been hit hardest during this crisis. And those include MNsure. So as many of you know, we've allowed a special enrollment period to MNsure so that uninsured individuals have 30 days to enroll in health insurance coverage. The second thing that we've done is really through the unemployment insurance at deed. So the state's unemployment insurance program has been expanded to those who are unable to work as a result of COVID-19 and is providing unemployment benefits quickly. Small business assistance, we've established a small business emergency loan program for businesses affected by COVID-19. Independent contractors, folks with 990s, can access this fund as well, and we would appreciate your assistance in helping to spread the word. Something that's been incredibly important to many of the folks on this call is suspension of evictions. We clarified that landlords and financial institutions cannot begin eviction proceedings that would remove tenants from stable housing during the COVID-19 pandemic. In a public health emergency, we cannot have people lose their safe shelter and risk their health and frankly, community spread. DHS services, the commissioner will certainly talk more about this, but we've increased the DHS commissioner's authority to allow her to ensure that over 1 million Minnesotans who are reliant on assistance and services from the agency continue to have access to the support that they need and deserve. And Commissioner Harpstead, again, will expand these details for you of this work. And then finally, paid sick leave. We have allowed state employees to take paid time to care of themselves and their families due to COVID, and we will continue to advocate for other employers to do the same. Not only do we want to manage our way through the current crisis, we want to make sure that our people and our communities are able to recover when this is over. This crisis is causing a lot of pain, but it's also giving us an understanding of who truly is essential. Educators, first responders, grocery store workers, healthcare providers, and nonprofit human service providers. We will also prove that things like paid family leave and reliable childcare are not nice to have, but are essential for the operation of our entire economy. Like the governor, again, I am grateful for your continued leadership and know, despite the difficulties that your organizations are experiencing right now, that we can count on you as partners as we move forward. We need you. The state needs you to help us respond and help us to recover. I'm proud of the work that we've done through executive orders and that we were able to pass in partnership with the state legislature. But I am very aware that needs will continue to surface as we live and really lean into the stay-at-home period and the downturn in our economy. I'm counting on nonprofit leaders to surface those needs and make specific requests to legislative leadership and the governor's office for further action during the resumed meeting of the legislature on April 14th. You can connect to our office. Our primary point of contact for all of you is Dominic McQuarrie with your policy ideas and budget requests. He can help connect you to the correct person on our policy team. And we are trying to have a clear flow through the office. And so Dominic is your person. And Marie has his information if you do not. But just a quick reminder though, the governor has expanded power under this peacetime emergency, but he does not have the power of the purse strings or the ability to appropriate money. That is the legislature's job. So we must work with the legislature. So we're counting on you to help us do that as well. The very specific ideas that you are bringing forward to better serve your communities will be the basis for future action. So I encourage you to use your individual and collective voice through the Council of Nonprofits. It is critical at this time, and I know that for many of us who are doing advocacy work, the idea of stay at home has proven to be a little bit more challenging, and we have to get creative in the way that we organize. And so want to just provide, again, that clear pathway for you to our office is Dominic. And we want to be responsive and connected and help amplify the things that you're asking for, as well as any additional communications or needs that you have. So please do not shy away from reaching out to us. And with that, I'm going to ask Commissioner Harpstead to say a few words about DHS's work with all of you and what you do to support Minnesotans. Commissioner Harpstead.
Thank you, Lieutenant Governor Flanagan, and thank you, John, and everyone who has joined us today. I want to just start by thanking all of you for who you are for your neighbors in Minnesota always, but especially in this unprecedented time. I want you to know that the Lieutenant Governor and I have been champions for our nonprofit partners and been advocating for information and answers and support for the nonprofit sector in the chaotic days that we've all been adjusting to the COVID peacetime emergency. We made sure that nonprofit staff and volunteers who, for example, do direct support or deliver food or prescriptions across Minnesota were included in the exemption list under the stay-at-home order. Our DHS webpage now contains a list of 20 major waivers and accommodations for flexing rules and regulations to allow nonprofits to make decisions for how to operate and to continue to support the people you support every day. As of Friday, I'm so pleased to say all of the decisions posted on our site also have federal approval, so they can be trusted and acted upon right now. It was difficult for us last week, people calling in to say, well, we're working on it. But now, as of Friday, all the decisions posted on the site have both state and federal approval, and you can act on them now. We are maintaining everyone on Medicaid and Minnesota Care healthcare coverage and MFIP, for example. We're moving to a lot of phone and video versus in-person services, counseling and assessments, and you can see all the other decisions on our website. You're also getting guidance out through your associations. The counties are getting guidance from us with even more specific information, so you'll be able to follow the rules that are in place in this interim time. I have a team of 6 senior DHS executives who meet every morning to study and make additional decisions on accommodations under Executive Order 2012. Many nonprofits and associations have written to us with the lists of the kinds of flexibilities they need, and we welcome all of those requests and all of those lists. They are all helpful for us to understand what you need on the ground to keep doing your work. I've seen the kinds of questions that came in for this call, for example. The more specific requests we get, the better we can consider them. My Chief of Staff, Stacy Twite, can receive your requests, and you can also continue to work with each of the services administrations that you usually work with. We've got things coming in from all different directions, and it's all good. Our priority in this health emergency, as the Lieutenant Governor said, has been those waivers and accommodations that would make the biggest and most immediate difference to protect the health and safety for the people you support. I totally appreciate the frustration that our executive order does not come with financial appropriations to support the infrastructure of your organizations in this uncertain time. I so understand that many of your organizations have little margins or operating reserves and how worried you are about your missions and about your employees. We'll continue to listen to your ideas, stand up whatever accommodations we can through our executive order. And we are also communicating with the chairs of the Health and Human Services legislative committees every few days, as required by our executive order, to tell them what kinds of things we are deciding and to tell them what we're hearing from the nonprofit sector across the state. So we have pretty direct access right now to the 4 chairs of the Health and Human Services committees to tell them the other things that you need that our executive order can't accommodate. And with that, I think we are ready to take questions.
Excellent. Thank you both. This is Marie Ellis. I'm the Public Policy Director at the Minnesota Council of Nonprofits. And I want to start out by really thanking the Office of the Governor and Lieutenant Governor for proactively reaching out to MCN and the nonprofit community to have this call and to seek out hearing more about our situations, our concerns, and hopefully some solutions as well. I think everyone knows that we solicited questions online, but there was a very quick turnaround for this first call. And so I think a lot of you probably have questions that you didn't have a chance to submit yet. But keep in mind, this is the first of 4, possibly more of these calls. So there's plenty of time to get your questions in. You can submit them now through the chat function, and we will save those. Also, when you register for the future calls, you'll be able to submit questions at that point as well. We did our best to address all of the issues that came in. There were quite a few, as I'm sure you can all imagine. And so the questions that I'll be asking today are based off a number of questions on the same topic that we tried to conglomerate together. So the questions are fairly long, so just bear with me. Question number 1. Many of the questions that we received were around clarity and flexibility needed from the state, particularly on the use of technology in providing direct services where in-person meetings or small group meetings are required. What direction has the Office of the Governor and Lieutenant Governor given to the state agencies who oversee nonprofit contracts? And how can the administration maximize flexibility so that nonprofits can best serve our clients in creative ways and not be constrained by contracting requirements that don't meet today's circumstances? A couple specific examples that we heard about in the questions were about mental health skills training and employment services, including MPIP.
So as I mentioned, of course, on our website, that is, in case you haven't found it, mn.gov/DHS/waivers and modifications. You can see the 20 decisions that we have already put up regarding the kinds of flexibilities that you need to keep your work going. I will tell you that so far we have been focused on supporting people with mental health and allowing for example, telephone mental health work. And we've been focused on keeping people on MFIP. So the questions you're asking now about mental health skills training and employment services that are out there regarding MFIP are the kind of next level questions that we're getting ready to explore as we move forward. We've been first, as we've said over and over, trying to stand up the things that have the most direct and immediate impact on the most people for their own safety and health. And now we can start to look at more things that affect your organizations and how you do your work.
Excellent. And if nonprofits have thoughts on how that next level of work can or should be done, what's the best way for them to get that information to you?
Well, I would love to see whatever else you collect. As you said, people can still put questions on the call here or send them to you, and we'll take every one of those. And again, my Chief of Staff, Stacy Twite, can take any of your questions. She leads our meetings every morning as we look at additional considerations. But everyone can continue to talk to the people you talk to normally in our various administrations for children and families, our continuing care for older adults, our community supports administration, and our healthcare administration, as you often do. And they're collecting ideas and bringing them to the table as well. There's no wrong door.
Excellent, thank you. And I'm seeing a number of questions on the chat function. Can you repeat the website with those waiver updates?
Yeah, well, of course, https://mn.gov/DHS/waivers and accommodations.
Excellent, thank you. All right, question number 2. The majority of questions that we received related to unemployment insurance, specifically from the employer side. So we greatly appreciate DEED's commitment to working with nonprofit employers. We're hearing that loud and clear. And the Office of the Governor and Executive Governor and Lieutenant Governor's executive orders that orders unemployment insurance rate will not increase due to an increase in COVID-19 related claims. That is an enormous relief for a lot of nonprofit employers. However, as I'm sure you know, some nonprofit employers are self-insured, also called reimbursing employers. For those, Congress has committed to covering 50% of the cost of unemployment claims. What relief can the state provide for those nonprofits, many of which will not be able to pay the other 50% for such an unexpected number of claims?
Sure, so I can take that one. We have received this question from a number of reimbursing employers across the state. The unemployment insurance program may statutorily suspend or waive interest and penalties accrued for reimbursing employers during this time period. And right now, DEED is looking into options for reimbursing employers and how to best operationalize those. So we're working on it, and we'll get back to you as soon as we can.
Okay, wonderful. Thank you. And you'll continue to hear from us, I'm sure. So
I'm sure. And Marie, can I just suggest too that we cut and paste the website that was shared by Commissioner Harpstead, and you can just share that with your members on the chat?
yes, definitely. Great suggestion.
Okay.
Thank you.
So I'm just asking Dom if you can just send that to Marie, and then she can share that with the folks who are on the call.
I did also put Dominic's email address in the chat function. So I apologize, Dominic, and you're welcome to everybody else. On to number 3. As you probably know, particularly since both of you have run nonprofits, 72% of Minnesota nonprofits have less than 6 months cash on hand, and 40% of Minnesota nonprofits have no operating reserve. Of those that do, it's usually under 5% of their annual operating budget. So understandably, we're seeing a lot of questions about state funding for nonprofits. And this is a 2-part question. So part 1, is it possible for state agencies to do things like expedite payments to nonprofits on contracts and grants, drop the one-to-one match requirement, or allow extensions for spending beyond the fiscal year?
All good questions, and we are looking at those. Some of the decisions we've made have moved money in terms of timing versus looking for additional funding, and so that's been possible in a couple of situations, but not like across the board, just as we look at each of these things that we've decided. As I'm sure you all are aware, any of you anyway, who have lobbied on behalf of your services at state government or worked with the Department of Human Services, so much of what we do is directed by state statutes. And our executive order gives us certain flexibilities, but not a broad range of flexibilities to move things around, especially when it comes to budget. We are accounting for everything we're doing that affects the state forecast and reviewing every dollar with MMB and making sure they understand impacts to the state forecast. So we're looking at both the forecast implications of our decisions and whether or not the executive order gives us flexibility to move things around. But we don't have a lot of freedom to just make across the board changes to things that are in Minnesota statutes.
Sure. I think we all understand that there's that dynamic between needing answers now and also not being able to just make blanket decisions. So thank you. The second part of that question related to funding and operating reserves. For nonprofits that need to close temporarily for the safety of their clients and staff, and therefore they cannot bill for services, is DHS or DEED considering what other states have already done in providing emergency funding or other resources while those organizations are closed so that they can reopen? Additionally, any other resources to provide financial relief for 501c3s that you know of?
I mean, I hate to bring it back here again, but again, anything that that needs money to be appropriated, we're going to need the legislature to appropriate that money to do it. We certainly know that there have been gaps in our early response to COVID-19, and I think of independent contractors and unemployment insurance. This is often not because we aren't thinking about it, but because it's not easy for us to do on our own. So please continue to push on us in the legislature to bring ideas forward to how we can continue to improve the response. And I also just want to acknowledge that we, in addition to a weekly call with all of you, we also have weekly calls with the Minnesota Council on Foundations. As much as we can, you know, at least on that call, I asked for foundations to be as flexible as they can. We are certainly working on that within our Department of Administration with flexibility of grants, and we'll continue to communicate that with all of you as we figure out where those requirements are with the feds and what we can do on the state level with those grants as well. But the thing that we asked for the Council of Nonprofits is to really think of increasing flexibility and as much as they can to shift dollars to general operating. And I know there's always a funky dynamic between funders and grantees, but this is the time, I think, for you to, as much as you can, ask for what you need. And I think this is a moment of extraordinary circumstances, and Gen Op use of dollars is likely to be one of the tools in our toolbox that can help us weather this storm in a better way. So I will continue to push our friends in philanthropy to do so, and I hope that you all are asking your funders for that flexibility that you need as well.
Thank you. One of my colleagues I know sits in on the meetings at the Office of Grant Management for the state, I think through the Department of Administration, and has noted that they've been really encouraging flexibility with state grants as well. So we really appreciate that. Lieutenant Governor, you mentioned the no evictions policy earlier, and I think it's safe to say as a sector, we applaud that. Is there any planned support for property owned for the unpaid rent that will happen with the no eviction policy? So the nonprofit who submitted this question notes that they are worried about their own budget and also concerned that it may precipitate the loss of naturally occurring affordable housing if property managers go out of business.
Right. So, you know, this is both for renters and property managers. I think this is a difficult time. First, I'd just like to say that the thing that job loss and income loss, you know, that folks are experiencing right now to keep our state safe will also be a major driver of unpaid rent. Our office wants to be clear, this is not a rent holiday. It's an eviction moratorium to protect the health and well-being of Minnesotans. So the governor and I, in our COVID-19 supplemental budget proposal, included dollars for rental assistance and homeless prevention, but could not get an agreement with the legislature. And this was actually despite agreement from a lot of property managers themselves. And so this is certainly a call to action for folks on this call that, you know, it is critical that this is addressed on April 14th at the legislature. We continue to work with the legislature to pass support for renters and property owners. But we also hope that the steps that we're taking around unemployment insurance and the federal government's efforts will help in the near term. But again, I think the evictions, the no evictions policy was a critically important step from just the health and well-being perspective. But we need also the legislature to do their part with rental assistance, and hope that you continue to ask them to do so.
Certainly, thank you. Next question comes from a residential facility who asks if there are any resources they can use to provide supplies for residential clients. They noted that they're struggling to find toilet paper, cleaning supplies, sanitizer, and masks.
I can tell you one thing that we did is the other day we found the Minnesota Department of Health's recommendations for the use of handmade masks. I appreciate that we've been talking to everyone who's been looking at personal protective equipment and the priority lists for those, and we all understand that the priority lists for those things start with the acute care hospitals right now in this health emergency. But we also wanted to help the nonprofit sector who has people who do non-medical services and don't normally stock any PPE, have at least something to use in this time. And I also appreciate the resilience of the nonprofit sector to turn to its own donors and supporters to collect items where it can. And so we have guidelines from the Minnesota Department of Health on the best way to do handmade masks. that's the safest and the most useful. And we are about to post that on the Minnesota Department of Human Services website, in the same place where we have the waivers that I mentioned earlier. And so I hope you can all turn to your donors and supporters with guidelines like that and ask them to do what they can to donate. And I would suggest the same thing about toilet paper, cleaning supplies, and sanitizer. And so if I were you, I would turn to your own list of supporters and donors to provide these things for your organizations and not wait in line at the place where the state is collecting these things for across the state.
Mm-hmm. That makes sense. Thank you. I think the new hot in-demand item is those thin strips of elastic that people are using when they make their own masks. I've heard they're hard to come by these days.
I'm also hearing, if I could just jump in on that,
sure,
that the healthcare workers prefer to wear tie-on masks and not elastic masks because it hurts their ears after working through a whole shift. And there are directions in the MDH guidelines for making sewn-on tie masks instead of the elastic.
Excellent. Thank you. I'm going to pass that on to a couple of my friends who are making masks, as you all should as well. We've got 2 questions left, and then I'll turn it back over to John to close us out. So second to last question. Obviously, you both know that a lot of essential services in the community rely on volunteers. The nonprofits rely on volunteers to run in the best of times and have seen an increased demand for volunteers right now when services are in higher demand. In general, will volunteers be able to continue working under the essential services category if the organization they volunteer with is in that category? And do you have any other thoughts on what nonprofits should consider when using and recruiting volunteers right now?
So I would say if volunteers are doing work on a critical service, they of course will be able to continue volunteering. In fact, we need more volunteers than ever at places like food banks and homeless shelters. And this is where we know that the decrease in volunteer shifts at food banks and shelters has been primarily because the folks who are volunteering at both of those places tend to be older and are folks who also may have underlying health conditions. So this is the time, if you feel so moved, to be able to volunteer or to reach out to folks who maybe haven't done that for your organization before, to ask them to step up. And we are happy to amplify in whatever way we can using our platforms the need to connect volunteers with your organizations where needed and appropriate.
I would just add to that, if I could, that the exemptions under the stay-at-home order had specific language about nonprofits and their volunteers, especially those who do things like deliver food and prescriptions right now. And what I was hearing from rural Minnesota, where of course the cases of COVID have been fewer reports so far, is that for every volunteer that was stepping back concerned, there were 2 stepping forward. And so we wanted to be sure those volunteers, especially in places in remote locations in Minnesota who are delivering food and prescription, could continue to do that. Of course, any volunteer who's out and about doing that work should follow all the guidelines of the distancing and the other precautions that we've heard so many things about. And you'll have to stay tuned, I think, for continued guidance, because this could change over the course of this emergency period.
Mm-hmm, certainly. And last question, has the Office of the Governor and Lieutenant Governor or the Department of Human Services been able to think about plans long-term for long-term support for nonprofits that will be needed after the pandemic ends?
So our office is always thinking about today and also the long game. But to be really honest with you, that balance is not quite where we would like to be right now. But we are all extremely concerned about what Minnesota looks like when all of this is over. We are clearly, as many of you are also doing, figuring out on how to meet the immediate need and urgency, but also the point of these calls and ongoing conversations with all of you, the legislative needs. We will need to continue to be partners to navigate this moving forward. One resource that I know of is the Small Business Assistance Disaster Loan Program, which is available to nonprofits and offers an interest rate of 2.75%. These loans have long-term repayment options of up to a maximum of 30 years. So if that is something that is of interest to you, that is certainly available. That being said, we are all living our lives through a world-altering event, which is touching all of us. And like your organizations, we feel that we have a mission that is to protect the health and well-being of Minnesotans. And there's a lot of pieces that we need to put back together. And we know that your organizations will really be an essential part of doing that. And we want to do that with you and not to you. And I can't stress that enough. The conversations that we are having, as I mentioned earlier in the call, are really about, who truly makes Minnesota work. And it isn't necessarily hedge fund managers. It's people who are doing direct service. It's folks who are providing care. It's teachers. It's nonprofit organizations who are on the front lines. And, my hope is that is the lasting effect of this pandemic, is that we truly realize who the most important folks are in this community who are caring for Minnesotans, and that is all of you. So this is the first of many conversations that we will be having. Again, please continue to reach out to the Department of Human Services, to our office directly through Dominic. Share your thoughts and your ideas, your needs and asks, ways that we can amplify the work that you're doing. Let's put it all on the table to figure it out. And as many of you can hear, that is my cat Yogi in the background, as I am also working from home today. So thank you so much to John and the Council of Nonprofits for bringing us together, for the work that you do every day, Marie, for being the primary point of contact for our office during this crisis, but as always, and for each of you and the work that you do every day. And Commissioner Harp said, thank you for also always being that voice in the room with the governor and myself, reminding us of just the incredible nonprofit community we have here and responsibility that we have to the nonprofit community as well. Thank you.
Yes, I would add to that as I mentioned, our very first focus has been on the health and safety of the people that your organization support, making sure people don't lose their health care, their MFIT benefits, their food benefits, their housing. We are hearing from many of you about the long-term support for nonprofits that you feel is needed, and that you're wondering about how this all ends, and we're listening to that. And we've had several conversations about that in our executive team at the Department of Human Services. I would share with you that some of the most creative ideas I've heard from the nonprofit sector include nonprofits thinking about how to adapt their work right now to be relevant and useful in the time of this COVID peacetime emergency, with the hopes that then they can get back to their normal work when it's over. But there are some nonprofits that are really thinking about how to jump in right now and be the most helpful with the kinds of resources, the people and the talents and the skills and the volunteers that they have to put shoulder to the wheel to get us through COVID, and then adapting back to the work they normally do afterward. I would also say that as my team meets every day to consider the kinds of flexibilities we can offer under Executive Order 2012, we have stood up most of the first really emergency health and safety kinds of things needed by people in our community. And we are now just beginning to turn our attention to some of the other longer term infrastructure ideas. And I imagine as we go forward. We'll continue to probably bounce back and forth between a sudden health safety issue that just came up that we hadn't anticipated and back to some of these longer term aspects of the work. And so I expect over the months that pass here, we can turn more of our attention from the immediate health and safety crisis to what happens later. So keep those ideas coming all the time. Do not be concerned about bothering us because we're busy. Keep it all coming in from any direction, no wrong door, and we'll continue to read, listen, and consider all of your ideas through this time. We need to tap all of the creativity of our resilient nonprofit sector to get all of us through this COVID emergency.
And we are indeed a resilient sector. Thank you. That was very well said. I think we often do worry that we're bothering elected officials and senior leadership. And so I appreciate the note. And I think it's really clear to all of us that you all are working incredibly hard. And so thank you for that. And to all the staff as well in your offices who I know are working like literally day and night. And I also, just before we go, to Lieutenant Governor Flanagan, I want to offer condolences on behalf of the whole nonprofit sector on the death of your brother. I think that actually hit a lot of us hard, even though we haven't met him, because we do know you and feel close to you. And I see the work that you're doing, and I think that must be particularly challenging in a time of grieving as well. So I just wanted to note that. And with that,
I appreciate that very much. I just want to say thank you. It has been an interesting time, and I use that in the most Minnesotan way possible to navigate through this crisis while also experiencing loss. But the outpouring of love and support from Minnesotans has been really incredible. And I've shared this with folks that my brother was a Marine, and he would want us to get back to it and do everything that we can to protect people. And so that's what we're doing. But thank you for your condolences. My family appreciates them.
Certainly.
And Marie, let me add my thanks to Lieutenant Governor Flanagan and Human Services Commissioner Harpstead. One of the keys in getting through this kind of a public health crisis is reliable communications and straight information. And thank you so much for making that available to us directly. We often end public policy calls like this with "to be continued," and that's absolutely true in this case. We'll be joined again a week from today, April 6th at 11:30, again with the governor's office and approaching some different topics, probably some updates. More information will be sent out from MCN and we'll be open and seeking questions and comments. And of course, any comments, feedback about this call today, we would welcome. And I think Marie Ellis may be a good person to field those comments. So thank you so much, and also to the governor who is with us at the beginning, and we will see you in a week. Thank you, everyone.
Thank you.
Thank you.